What is something that most people don't know about working in health tech that you think they should know?
The biggest thing to me is we're just not data collectors.
Yeah.
We use that information. We not only want to make sure that it's accurate and timely and collect the data points, but we want to empower the staff to make process improvements based on that information. We all remember the days when we would go to the surgeon and say, "Hey, I don't this medicine, this procedure, this outcome is we're seeing this across the board. I've seen this with your last 6 patients. They're bleeding. I'm cardiovascular CVICU nurse. They're bleeding. What's going on?" We did not have the power of the data points to
Mm,
share at that point. So now if we can give them that, we can empower the staff to make those process improvements as fast as we can instead of waiting for 6 months down the road. So that's
yeah,
the biggest thing.
that timely impact is definitely an important key. What is one piece of advice you would give to prospective nurses who think they might be interested in health tech?
Get your clinical experience first. You need to know what the problems are and come up with the solutions. If you're not living through the problems, you cannot come with the best solution. We've all been in that seat saying, "Oh yeah, just do it this way." That doesn't work because of this, that, or the other thing, which you would know if you were on that clinical front line.
It's kind of like someone without kids telling you how you should parent. It's like,
Exactly.
okay, well, we'll wait and see till you have kids and see how that works out for you.
Exactly, and living that right now, my husband and I, we met in nursing school and we have 7 kids, and seeing that with our children that are now we just have our first grandchild, and it's like, "Wow, wait a minute. I could tell you how" the older one saying, "This is what I would do with the younger one," and now that they are a parent, they're like, "Whoa, wait a minute."
Exactly. I remember
Whole
my mom.
different Yep. There's so much, but I mean, the clinical experience is by far the most valuable. They also can start working in some of the registries, which gets you that data collection experience. So, for instance, a lot of the STS registries will rely on their ICU nurses to get that information and to be more accurate on their timing of their ICU hours and making sure their intubation times are up to date. If you don't have that clinical experience, how can you pull those data points? You can read that definition on this is the device they use for the TAVR procedure. But unless you've had that experience standing at the table, you're not going to be able to relay that and paint a perfect picture of that patient.
Right. And you say registries. And so that makes me, as a stroke nurse, think of Get With the Guidelines, putting in all of our stroke data points. And that lets us know, how the outcomes are, but also what were the steps that led up to those outcomes and let us know which goals we can work towards. And so
Exactly.
it's incredibly important to
We deal
put
with
this.
those points too, especially with the stroke patients or the STEMI patients to make those process improvements on the fly. We can say, "Hey, we did this with the code stroke that came in last week. Now we have the evidence that shows, yeah, this got our inject time down by 10 minutes. How can we mirror this and complete this? Or this didn't work instead of waiting for 6 months down the road." And that's where our company takes those LLMs and is able to pull that out from those EMS, which is pretty amazing to me, from the EMS records to see that as long as they're scanned in, we can read that. We can see some of those timestamps in there too, especially with the stroke and the STEMI patients, and get that back to you at the end of the week, as opposed to waiting until you submit it through AHA and then wait for the data to come back. And when I first started working in the registry world long ago, I graduated in 1990, and one of the CT surgeons I worked with initially said, and I took his blood usage to him 6 months after when the STS report came back. And he said, "Betsy, if I would have known this, I could have changed my practice 6 months ago. If these things were impactful, if this was what they were looking at." So from then on, I had huge spreadsheets that I'd hang in the doctor's lounge and say, "Here's all your blood usage, your time, your OR time, your skin cut times." And they were able to transition that live time then. And they were like, hey, I already knew this. Plus, you want to know everything before you see it published. That's a big thing with the
Yeah.
registry. You
That
don't
way, when it is published, you can say, and these are the steps we are taking to improve this. So the next round will be better.
Exactly. And that's what we want. We want no surprises. We want to make sure that they're going to see, because when you see that star rating or if you see that NCDR report on your dashboard, the executives that are reading that don't have that insight. So you can prep them. That's what we tell our teams that we work with. You
Mhm.
make that process improvement. We've had teams that have worked with discharge medications, and they've been able to take that back and say, "This is what you did this past week. Let's improve for next week. Let's set this goal this week." And then they're able to take that to their executive teams and say, "This is what we've done. Even though we look like this, here's our weekly tracking." And if you don't have that clinical knowledge, you're unable to translate that into those. You're just data collecting.
Right. And, as clinicians, it's not as much as we want non clinical people to not be making the decisions, that means the onus is on the clinicians to see what the problem is, come up with a solution, and then let administrators who don't have that frame of reference know what we think the solution is. It's not fair for us to expect them to come up with a solution to our clinical
Exactly.
problems. Yeah.
Exactly. And that's where I think that healthcare has led itself in the past 10 years, especially
Mm.
with people that are non-clinical that are making those decisions based maybe on budget, maybe on staffing, maybe on inadequate preparation on their part and running it maybe as a business as opposed to somebody as a healthcare business. So I think that we can, by having these data points which translates over to non-clinical people, they're able to see that. So we have a lot of power with data points, that we're able to translate that over because that's what the rest of the world deals with.
Mhm.
We can say this, you've had that patient in front of you and had that gut feeling like, I can't say it, their pressure's fine, everything else looks good, but I just don't know. Something's wrong. I'm watching them. You can call a doctor and say that, but you can't call a director or a quality director and say, this is why I spent 4 extra hours with this patient. So we have to have that data point and say, this is why we need more staff. This is why we need process change in processes. And data is impactful. That's, that I can't say enough. And the other thing too is, as we orient new nurses, we always say, okay, you have a problem. I want you to come up with 3 solutions before you call that physician. I want you to present the patient in order. I don't want you to say, yeah, that patient that's you have down in room 10, give the facts and then follow up with a solution. This is what I would like to do. Let them make that decision, especially, and that's where your data and your clinical experience comes into play.
That's right.
And
Nurses are critical to the decision-making process.
exactly. And present that to your administrators when you want to make process changes. Present that to them in the same exact way. Say, this is my problem. I'm not getting all of my discharge meds written. Patients are leaving without orders. This is what I propose to do. These are the facts that support this, and this is what I propose to do. And make those changes.
Exactly. Complaining about a problem doesn't do any good if you don't
Not
have
fix it.
any idea of a solution. Now, if you have an idea for a solution, then you got to figure out how to fund it. That's a different problem. Or we need you for this.
And that's what we're trying to solve too by making this faster because data collection has been outside of the clinical arena. If we can make it streamlined, make it faster, use these LLMs, use, the NLPs to pull that information in, we have power. We have a
Mhm.
lot, and it not only gives us more power with administration, it also gives us more time with the patient to
Mhm.
assess them. Because if we're not sitting there looking for, oh yeah, in 1922 you had an MI. No, we have that information and we're presenting it right in front of you. So you can see that as we're going through. Make those critical decisions faster.
Yeah. So does CARTA just work with EMS records or does it work with all
No.
electronic health records?
It works with we work with all of the EMRs, and we're branching out into some of the physician office notes, those types of things. It was interesting, and some of our staff. our engineers were very surprised. We threw a fishbone at them and we said, okay, and it produced it. It produced all of the lab values for us. It came off of a pump run sheet. And if you say the start time of the procedure was 12:01 and the procedure lasted 59 minutes, it gives you an end time. It doesn't, because some of the registry questions ask for the end time. So if you want the echo that's closest to the procedure time, we're able to pull that based on the constraints that we ask the question in.
Fantastic. Well, this is an incredible resource. Thank you so much for sharing about that, and also just like big picture, the importance of the role of nurses in the health tech space to connect these dots.
It's fascinating, and we've got a long way to go, but we're giving the nurses the tools that they're able to solve some of these very, very complex problems that we've had over the years.
Definitely. I can imagine some really good uses for that.
And like I taken a note from you, the collaboration is power, and that's where we have to do that. We have to learn how to interface and make sure that we're getting the tools to the people that are on the front lines.
Definitely. Are you and I already connected on LinkedIn?
I do not think so. I will go ahead and do that one
Yeah.
this afternoon and make sure that we have that. And hopefully we can meet up at Health. I will be there.
Yes,
So
me
that would be wonderful. I love the focus that they're having on nursing this year.
too.
So I'm very excited.
I'll be in the nursing pavilion for Power Up Nursing, and then also hanging around the Health Podcast Network buddies as much as I can. So
I'm very excited because usually it's not as nursing focused. So I was very excited to see some of the sessions they're offering.
I'm so grateful to be included because, I mean, how are we supposed to make healthcare better without including nurses? So, are you going to be at a certain area? Are you going to be able to walk around?
I will be able to walk around. Most of our C-suite will be there too, and some of our engineers are also going to attend. So it will be an eye-opening for everybody. We're looking forward to it.
Awesome. And then Grace has said we'll try to get a group picture, I think, while we're there.
Excellent. Well, thank you, and please let me know, and I will connect with you on LinkedIn.
All right. Sounds good, Betsy. Nice to
All
meet
right.
you.
Thank you. Nice to meet you too.